31,
32, 33,
34, 35. Whew. Health is wealth, they say. But when it comes to insurances, which path should you choose? Have you ever wondered why on earth there are two health systems in Germany, public and private, and what's best for you? Do you want to check out your options to grant you the best medical support today and for the time to come? Then stick around. Today we reveal the secrets of the two health systems. Get ready for the ultimate showdown between public and private health insurance in Germany. I'm Tobias from Work-Life Finance. I'm guiding my clients through the jungle of insurances and investments. With the fantastic network of MLP Finanzberatung, I can provide you with the best products and the best suppliers on the German market. So, let's dive in. Let's look at the 4 basic points which differentiate the public and private health insurance. Number 1, we will look at how the systems are organized. Number 2, we will have a look at how the contributions, so what do you pay for the insurance. Number 3 will be what you get actually. So this means the service level in the health insurance. And number 4 is who can at all opt for the private system, and basically which people are in the private system compared to who is insured in the public system. Public system is a continuous financing model. This means the expenses for doctors, hospitals, medication are paid by the contributions of the employees and their employers. Basically, there are people in Germany receiving services from the health system without any contributions. That's, for example, children, unemployed people, or marriage partners without a job. The contribution for the public health insurance is determined by 2 things. One is the percentage given from the government and the chosen provider. The second one is your salary. So when you add up all the percentages for health insurance, nursery insurance, for someone without any kids, this will add up to 20.3% of your salary. This means if your salary is 2,000 euros, your contribution is 400 euros roundabout, shared by you and your employer. If your salary is 4,000 euros, your contribution is 20% out of 4,000 euros, 800 euros, shared by you and your employer. This will max out to the Beitragsbemessungsgrenze, so that's the maximum ceiling of your salary where the 20% are taken from. At the moment, that is 5,175 euro. Well, when you multiply 5,175 with 20.3%, we will look at around 1,050 euros, depending on which insurance company you have chosen. Contribution for the private health insurance depends on your age of entry. The younger you enter, the lower the contribution will be throughout your life. Then your service level. So if you're choosing a 5-star service, of course, it's more important than a 4-star or 3-star service. So that's up to you. You get what you pay for. And the third point is the state of your health at the time you're entering or applying for the private health insurance. This means when you're healthy and young, your contribution will be quite low. When you're already ill, then you might get some difficulties of entering the private system at all. Once you're in the private health insurance, your state of health will not influence your own contribution, and it's safe once you're in. The health insurance cannot cancel your contract because you're ill. So the private health insurance also builds up reserves for later, because it's obvious when we're older we need more medication, more treatments, and so on. And this is why a part of the contribution is put into a reserve pot for you only. This reserve has grown over the last 20-30 years and is at the moment around 320 billion euros. With around 8 million people in the private health system, this means reserves for later times around 40,000 euros on average. The service level of the public health insurance is determined by the politicians, no matter in which of the 100 insurances you are. Techniker Krankenkasse, TK, Barmer, AOK. So the service level is 95% the same. Whereas in the private system, you can choose the service level which is important for you, and only you can change this. So otherwise it's guaranteed services for throughout your life. In the last 30 years, there have been a lot of health reforms which mostly decreased the level of the services, because the spendings for the public health insurance have increased a lot. In the private system, it's like you can choose from a menu in a restaurant. So the service level can be from very sophisticated single bed in a hospital, healer, massage, physiotherapy, very latest technologies for your teeth. And so you can choose from a 5-star treatment, like in a hotel category, to a 1-star treatment if you only want the cheapest insurance. Most of my clients go for a 4 or 5-star service, because when you enter the private health insurance at a rather young age, the costs of a 5-star or 4-star service often is lower than the cost for the public system. But we come to that in a minute. Look at who is insured in which system. We might start with the private system. So when you're an employee, you're allowed to change to the private system only when your salary is above a certain threshold. For 2024, that's 69,300 euros of gross salary each year, or 5,750 euros. So all employees below this salary are forced to stay in the public system and could only opt for additional insurances for parts like dental services or a hospital treatment. In addition, you can enter the private system when you're a freelancer, so when you're an entrepreneur, and when you're a civil servant. Considering that the average salary in Germany is around 35,000 euros per year, it's obvious that most of the employees are forced to stay in the public system. Include the difference of the two systems. In my opinion, it's obvious that the private system offers a lot of advantages compared to the public system. So in the private system, you can choose your service level. Often you can save some money compared to the public system, and the service level you have chosen will stay for you for your whole life. In my opinion, that's the biggest advantage. So how can you choose the best product out of the 35 private health insurance companies? Well, that's not so easy. We got an excellent tool, so we can look at the different service levels. So which service level is the right for you? We speak about, do you go for 5-star, 4-star, or maybe a 3-star service is enough for your personal needs. It's much better than the public system anyway. Then we will look at the different insurance companies. We will look how stable they are in their financial balances. We will look at how good is their service, and then we will compare the products in every detail, from dentist, hospital services, doctor services, worldwide coverage. So there's a list of over 30, 40 different points which we go along, and then find out the best insurance for you. I hope you've enjoyed the comparison between the two health systems in Germany. From the hundreds of talks in the last few years, I can tell you we only scratched the surface. So you might have your own questions, your own issues. I don't know what they look like, but I'm inviting you to send me an email, call me on the phone, drop me a comment, so we can get in touch and discover the right protection for your health now and for the time to come. Remember, health is wealth. 31, 32, 33, 35, 34.